There are so many symptoms. Like you might think, well, but maybe I'm having these symptoms for a different reason. It's probably important not to ignore the symptoms and actually just go and have that conversation so that like someone like yourself and an expert in this area can help people actually figure out, well, actually, oh wow, I am in menopause and I do need some help and there are options. I wonder how many women maybe have kind of milder symptoms and mightn't realise that it's because of this reason.
Yeah, I think we're all kind of familiar with hot flushes and night sweats, and that really can be the kind of classic symptoms that we'd associate with menopause. The things that trip people up are perimenopause. So these are women who are still having periods. They may be irregular, but they're still having periods. But what's happening in the background is that their ovarian production of hormones like estrogen has started to fluctuate and change and be more erratic. And those symptoms can really sneak up on you. So things like worsening PMS type symptoms, feeling more emotionally labile, maybe feeling more irritable, maybe feeling more low, like feeling flat and not being able to get the same amount of enjoyment out of things that you did previously. And even there's other things like cognitive changes. We see women often report a change, particularly in verbal fluency. So their ability to find the right word, to think of someone's name, and all of that can have a really big impact on your confidence, both in work, at home, socially. And they're things that can really sneak up on you, as they say. They're not the kind of, smack you across the face and getting a hot flush. That's really easy to kind of objectively see. And they're often things that women, I think, almost attribute to well, it's normal and it's part of maybe aging and there's nothing I can do about it. And so they let it slide when actually there's lots that we can do potentially.
Yeah, and that's exactly why it's so great for kind of all of this to be, for the media and to be paying more attention to menopause and creating more awareness, because genuinely you mightn't have known previously that they were symptoms. So it's good to be getting that information out there.
Yeah, it's about joining the dots, I think, and realising that, look, you have estrogen receptors from the top of your head to the tips of your toes, and how these symptoms manifest as you lose estrogen, as you move through perimenopause and then to menopause when your ovaries have stopped producing estrogen. I think joining the dots and knowing that, okay, hot flushes, as I say, are so well known, but things like burning tongue or tingling, I think of formication where you get tingling, crawling skin, or a change in joint aches and pains or fatigue, or, the list goes on. Vulvovaginal symptoms are very common too. So changes in vaginal tissue, which can lead to vaginal dryness, uncomfortable sex, and even urinary symptoms. So things like peeing frequently or recurrent urine infections, and mood changes, which I keep sort of bringing back in, but I bring them back in because they're so important and they can be so impactful. Yeah. And knowing that, okay, maybe they're due to some other cause, and that's always a possibility, but they might be hormonal and there might be something that we can do to help.
I'm 17 years listening to the pains of people saying they'll come to me for a lifestyle thing, but they'll just be talking about all their symptoms and they're struggling, and people would say to me, I literally feel like I'm going mad. I don't know what to do. I can't think. And it really it's very upsetting. Like, I'm doing the best I can from the lifestyle perspective, but for me to be able to say, well, actually we have these wonderful specialists that I really think that you should go and talk to, and then to listen to the other side of the journey where they come back and say, do you know what? And like you said, because nothing is an instant fix, but a couple of months down the line, having been to you and having been to other wonderful people who specialise in this area in this country, and they're starting to regain control of themselves, of their thoughts, of how well they feel. This makes the world of the difference to